This video is going to cover ultrasound imaging. So ultrasound has been around since 1956. So it's an older, relatively older imaging modality, but it has been growing substantially in its clinical use in recent years due to its affordability, mobility, and speed. Its use has especially expanded in the emergency setting with the introduction of mobile device compatible ultrasound probes. So you can see an example of one of those over here on the right. So you can plug it right into your smartphone. Primarily iPhones have the majority of these probes that work. And so you think about an ER physician, resident, etc. They can simply plug it in, and then they have this immediate ability to scan anybody anywhere that they are within the hospital. So it's very rapid, very quick, and very easy to use. So in terms of the way that ultrasound actually works, is it sends a high frequency sound wave or a series of sound waves into the body, and then it measures the time and magnitude of the echoes or the sound waves that bounce back to the detector. And so the video linked below, you can see right here, Physics of Ultrasound, does a really great job of explaining this in more detail. So I'd strongly recommend that you watch that video. It's very short, it's about a minute long, and it gives you, I think, really, really nice explanation of how ultrasound works, which is important in understanding what you're looking at on ultrasound. So that's why I think that's useful. One of the advantages of ultrasound, like MRI, is that it does not use ionizing radiation. So that said, it's not 100% benign either. So it can cause significant heating of tissues, including the fetuses, and so it does need to be used with caution. Now, one of the major sort of downsides, so to speak, of ultrasound is it takes a lot of practice to get good at interpreting what you're looking at on ultrasound. So we're going to kind of play a little bit of a game here and see if you can identify what structures I'm presenting to you right now. So first off, looking at this image, again, this is the same organ from three different patients. I'm sorry. And so this actually represents the kidneys. So you can see the kidneys, they have somewhat of a distinct look. I think if you look at the far right-hand image, that's where that looks the most like the kidney. But on the left, that's a very typical appearance of the kidney on ultrasound. So now looking at this image, hopefully you can appreciate the fact that this large black void here is exactly that. It's an open space, and this is an abdominal cavity. So this structure right here would be the gallbladder. So you're looking at the gallbladder. You can see that quite nice. And then you can see on the right-hand image where you see the S on the image, that S represents a shadow that's produced by a calcification. In this case, it's a gallstone that's present right there. So you get this shadowing effect. So that's a hallmark sign that you can use when you're looking at the gallbladder. And you see that kind of shadow effect like that, you can be very confident that there is a gallbladder or a gallstone present at that point. Now, interestingly, this is in the same patient, so you can see how getting your probe oriented in the correct position is really, really important. So looking at this image now, just take a minute to see if you can think of what you think this organ might be. So it turns out this is the liver. And again, this is a relatively standard or textbook view of the liver. So usually you can see several different veins. So you can see like the R, M, and L in the left-hand picture. That represents the right, left, and middle hepatic veins traveling through the liver. So usually you'll see fairly large veins and usually kind of some cross-sectional views as well of the veins that are located and even some of the arteries that are located throughout the liver and the liver parenchyma. So now take a minute and look at this one. So this is in the head and neck, if that helps you with localizing where you're at. So right in the midline, that whole dark area, that represents the trachea, so it's labeled TR. And then you can think about the organ that surrounds the trachea. That's going to be your thyroid gland in the neck. And so that's what you're looking at, that T labeled structure that you can see kind of looping around on either side of and anteriorly relative to the trachea. That's going to be the thyroid gland. And then just lateral to that, you can see the common carotid artery labeled there as well with a C on it. And then on the left-hand side of your image, you're looking there at the jugular vein located, again, adjacent to the common carotid artery. Okay, now this is probably getting a little bit more challenging, but this is going to be an image from an extremity. So try to think of what you might be looking at in these four images here. So these represent tendons, and tendons are a relatively common target for ultrasound imaging. You're able to appreciate tendons relatively well with ultrasound, though you don't have great resolution, but you can make them out. And so on the left-hand side in A, this is the same tendon, just with kind of turning the ultrasound probe a little bit, where you can see the, like in the left-hand image, it's relatively hypoechoic, so it's not very bright. Whereas on the right-hand side, you can see now it's much brighter, and so that represents a hyperechoic structure. And so that's the way that you typically expect to see a tendon is with that hyperechoic property to it. Now looking at the right hand image, once again, this is another tendon now this time in the forearm. This is the flexor pollicis longus tendon, and so you can once again see on the left hand image you have kind of this hypoechoic appearance to it. And on the right, as the ultrasound probe, its orientation is changed just slightly to where it's exactly 90 degrees relative to the tendon. Then you get that nice hyperechoic appearance of the tendon. So again, you can see how challenging it can be to identify exactly what it is that you're looking at on ultrasound. Another way that ultrasound is used is guiding the insertion of needles into the body. That's common in anesthesia. So you'll see that with placing central lines and other lines in the body, and then also for nerve blocks to make sure that you get the needle right up to the nerve and even get it into the epineurium, and be able to make sure that you adequately or effectively anesthetize whatever the nerve is that you're seeking to block. So it's another way that ultrasound is commonly used. Now, another way that it's used as well is to use it as a Doppler. So in this case, you think about the Doppler effect, where a train goes by and you hear the horn kind of change pitch as it goes by based on the way that the sound waves are traveling relative to the train and your position. So in this case, what we can do is use the ultrasound to look at the magnitude and direction of a moving fluid, in this case blood. So in this image, you can see the red represents the common carotid artery, the blue represents the internal jugular vein. And there's actually the link at the top of this where it says as a Doppler. That will take you to a video that will I think is really good. It shows you a real-time image or video of this patient being imaged, looking at their carotid artery and their internal jugular vein. So you get kind of a sense of how ultrasound can be used effectively as a Doppler. So just real quick to summarize before we move into this 3D sonography. So what I really want you to realize is that although it's difficult to interpret ultrasound images, there are some things that can help with it. So number one, ultrasound images present white echoes on a black background. So again, you should expect structures that the ultrasound probe or the ultrasound waves are coming into contact with and sending a signal back to the ultrasound probe. That is going to generate a white image. Okay, so again, voids are going to look black, whereas the structures themselves that are sending that wave back to the ultrasound probe, those are going to appear white. So again, keep that in mind. Color, which again you've seen, is usually represented in the form of a heat map, but so a lot of the time you'll see it sort of red, blue, yellow, kind of showing you the intensity and the directionality of the fluid that you're looking at in terms of how it's moving. So some recent advancements in ultrasound imaging include 3D rendering, which you can see represented right here. So on the far left-hand image, the dark black line that you see in the upper left-hand side, that is representing the common carotid artery. In A below that, you can see a cross-sectional view of the common carotid artery. And so again, you're getting sort of this three-dimensional representation of that vessel. In the middle, of course, we have a 3D sonogram of a fetus. So you can see how you get a very impressive three-dimensional rendering with 3D sonography. And on the far right-hand side, this is looking at some of the cortical arteries located within the kidneys. And so again, you can see how ultrasound can be used to generate these really powerful images. Now, another way that ultrasound is also being advanced is with the development of microbubble contrast agents. So this is relatively new, but it is showing a pretty significant amount of promise. And then finally, therapeutic ultrasound as opposed to diagnostic ultrasound, like what we're talking about, where we use ultrasound to generate images that can then be used to diagnose various diseases and/or injuries, is also actively being developed for a number of conditions. So one of the most notable is for Alzheimer's disease and other dementias. They're looking at opening or basically treating the blood-brain barrier with ultrasound and thereby generating potential therapeutic effect. And again, there's a number of other examples where that's occurring as well. So again, ultrasound is a growing field. It's a very, very important imaging modality and something that you want to keep in mind as you are moving forward in your training, that you want to get really good at being able to identify anatomy on ultrasound, because it's going to become a bigger and bigger part of clinical practice.